जी, Assalamualaikum. Today I will discuss about important X-ray chest. First of all, this is normal X-ray chest. You can see the red mark and the dotted yellow mark. These are the claustrophrenic angles, which are usually not having any white opacity. Here you can see pleural effusion, which is white homogeneous opacity, and there is a curve on its upper part. And usually this shows that this is fluid, and it is because of gravity that the curve is like this. This is the just X-ray of acute respiratory distress syndrome. In this, you can see the heart size is normal and there are bilateral infiltrates. This type of X-ray can be found in acute pulmonary edema as well. Now, this is the X-ray in which there is a wedge-shaped opacity, which is a consolidation. It's a homogeneous white-colored opacity. This consolidation can be because of pulmonary embolism, or it can be because of pneumonia, or it can be because of tuberculosis. There can be any reason of this wedge-shaped opacity. And then after this X-ray, we have another X-ray. And, this X-ray is again of EARDS, or it can be because of pulmonary edema. It is acute. Heart size will not be enlarged, and there will be bilateral infiltrates. Such type of findings with bilateral infiltrates can be also found in uh, uh, COVID pneumonia. This is the X-ray of pulmonary edema, typical X-ray. Their heart size is enlarged and there are bilateral infiltrates and curly A line, curly B line and upper lobe diversion. You can see here heart size is enlarged. Now this is the X-ray of the miliary tuberculosis. You can see the white and the black dots just like millet seeds. You can see they are widespread in both lungs and in all zones. Then this is the X-ray of the pneumothorax. You can see that one lung it has got normal bronchovascular marking, and the right lung and the left lung is more black because of air. And the arrows they are showing the collapsed border of the lung. So lung is collapsed because of the air, which is jet black, and it is pushing the lung towards right side. So this is the X-ray of the pneumothorax. Now this is the X-ray of collapse, and you can see that the collapse is pushing the trachea towards itself. Now the trachea is actually black color sort of tubular structure which you can see in between the two leafy lines of the clavicle. Here is the last X-ray which is showing a ring on the left middle zone, and you can see that this is the cavitating lung disease. Now the important CT brain, this is a CT brain of intracerebral hemorrhage which is big, and it is white in color and it is surrounded by gray cerebral edema, and this hemorrhage and cerebral edema is shifting the midline. The midline is being shifted. This is cerebral infarction, which is grayish black in color, and it's quite massive. So this is black in color, grayish black, while the hemorrhage is white in color. So these are the common CT scans which you will come across in our ward. Then this is the CT scan of the cerebral atrophy, where the ventricles are prominent, and the black wavy lines, they are actually the sulci and gyri. In a brain of cerebral atrophy, the ventricles they are prominent, But if the sulci and gyri, they are also prominent, like in this CT scan, then this is not hydrocephalus, this is atrophy. On the other hand, this is hydrocephalus where only ventricles they are prominent and the rest of the brain is normal. Sulci and gyri, they are not prominent at all. You can see this is the city of hydrocephalus, while previous city was of cerebral atrophy. Then, after the hydrocephalus, we have another CT scan, and that is a CT scan of cerebral edema. You can see that here you cannot appreciate the ventricles, and the whole brain is having light gray color markings, which is basically cerebral edema, and there are no sulci at all, which is showing that this is cerebral edema. So you will come across when there is raised intracranial pressure, you will see. Now these are the tuberculomas. We usually occurs in tuberculous meningitis. You can see the white spots everywhere in this CT brain. So these are the tuberculomas. Now this is the last CT which is showing intracranial brain tumors of different types. Some are white in color, some they have got ring enhancement. So I hope this video will be helpful for you. Thank you for watching. Allah Hafiz.